Assalamu alaikum everyone, welcome back to another ATP video. Today we'll be talking about a gram-negative bacteria called Coxiella burnetii. Starting with the basics, Coxiella is a gram-negative, obligate intracellular rod. It can cause an infection called Q fever. Coxiella is a zoonotic infection, which means that the disease is transferred from animals to humans. Farm animals are the main reservoir, so think about cows and sheep when Coxiella is mentioned. The bacteria form a very strong spore-like structure that can survive in the animal's digestive tracts, as well as withstand high temperatures. They can then be found in animal droppings, soil, and milk, and be transmitted through ingestion. However, the main transmission route to humans is actually aerosol transmission, where contaminated soil is transferred by wind and results in infection. So, unfortunately, even if you don't live on a farm, you're still at risk. We mentioned previously that Coxiella can survive in extreme environments. This happens due to its ability to survive inside macrophages. Normally, what happens is bacteria is ingested by a macrophage and then gets destroyed and we remain healthy. With Coxiella, however, macrophages ingest them but are unable to destroy them. This is because Coxiella inhibits the final phagosome maturation step by producing superoxide dismutase enzyme that protects it from being killed. So what happens is Coxiella gets entrapped into the autolysosome and just sits inside the macrophage. Moving on to the symptoms, acute Q fever can present with flu-like symptoms and pneumonia. The flu-like symptoms include a high fever, headache, myalgia, and fatigue. These are pretty common in many infections, but Coxiella has a unique presentation, which is hepatitis. If a patient comes with a history of animal contact, fever, and hepatitis, you should think about Coxiella right away. You can keep the important symptoms in mind by remembering the phrase, farms have hay, representing fever for the F, headache for the H, and the other H for hepatitis. This again will also remind you about how farm animals are the main source of the infection. The chronic form of Q fever is not very common. It usually affects immunocompromised patients and people with vascular disease. The most common manifestation of the chronic form is endocarditis. Alright, on to the diagnosis. Serology and polymerase chain reaction, PCR for short, can be used. However, the standard testing is done by indirect immunofluorescence assay, IFA. And the final part of today's video, we have the treatment. Acute Q fever is usually self-limiting, so most patients don't require anything and would improve with symptomatic therapy. However, more severe cases can be treated with doxycycline. The duration of treatment on average would be 2 weeks. For the chronic form, doxycycline is still given, but in combination with hydroxychloroquine for several months. So as you can see, there is a very large gap in the duration of treatment between the acute and chronic forms. And finally, prevention. Ways of prevention include pasteurizing milk and generally maintaining good hygiene. Okay, so a quick recap. Coxiella is a gram-negative, obligate intracellular bacterium. It causes zoonotic infections, Q fever, which is mainly transferred from farm animals through aerosol transmission. It has the ability to survive inside macrophages by producing superoxide dismutase, and it causes Q fever that presents with fever, headache, and hepatitis, and the rare chronic form which results in endocarditis. The main method of diagnosis is indirect immunofluorescence assay, and for the treatment, the acute form is treated with doxycycline, while the chronic form is treated with combination of doxycycline and hydroxychloroquine. As for prevention, these include avoiding raw milk consumption and good hygiene. And that's it for Coxiella burnetii. We hope you found it beneficial. Don't forget to like, share, and subscribe to receive our latest updates. And as always, thanks for watching.